So in this first section regarding gastritis, we'll be studying about acute and chronic gastritis and the differences between them. So we'll be studying about acute gastritis, and then we'll be studying a form of acute gastritis known as the acute erosive gastritis, which is also called as reactive gastropathies. And then we'll be studying about chronic gastritis in detail. So acute gastritis is the sudden inflammation of the lining of the stomach. It is usually rare and it is characterized by dense infiltration of the stomach with neutrophilic leukocytes. So it is also known as acute neutrophilic gastritis due to the infiltration of specifically neutrophils, and it is usually occurring due to gastric infections and invasive organisms. So in this picture, we can see this is this histological picture of the stomach lining, and we can see this gastric ulcers and erosions that can be seen microscopically. So there are two forms of gastritis. One is known as the phlegmonous gastritis. So in detail, if we study about phlegmonous gastritis, it is the infection of the gastric submucosa and muscularis propria, and it is sparing the normal mucosa. It may simulate a mass like a picture, and the infection usually may spread to liver and spleen. Other than that, it is usually associated with alcohol intake and upper respiratory tract infection and AIDS. The second type of acute gastritis, which is a more severe form of phlegmonous gastritis, is known as emphysematous gastritis. So the features of emphysematous gastritis is that it is usually caused by infections regarding gas-producing organisms. If we see radiologically through the plain X-ray films, we can see gas bubbles, which also may form in the shape of cystic gas bubbles. Other than that, these gas bubbles are also present in the stomach and in the intestine lining. Other than that, this sort of gastritis may also proceed into a more complicated form, which is called as the gas gangrene. It is also occurring after specific surgeries such as the surgery to the stomach or the gastric surgeries, and by the ingestion of corrosive materials, and it is a complication of gastroenteritis. So in this picture, we can see these erosions in the stomach lining, which represents an acute gastritis. So acute gastritis, we'd be seeing how does a patient present with acute gastritis. A patient might present with an acute upper abdominal pain. The patient might present with peritonitis, with purulent form of ascitic fluid. The patient might present with fever which might be high grade. And lastly, the patient might present with hypotension. So regarding the diagnosis of acute gastritis, how can we diagnose a patient regarding acute gastritis? The patient might present with a plain film, which is an X-ray. We can also perform an ultrasound in these patients. CT scan is also helpful, gastroscopy, and finally gastroscopy with or without biopsy and culture. Biopsy and culture is also necessary to find out the invasion regarding the cells microscopically. So if we talk about acute gastritis in detail, the stomach wall appears thick and edematous with perforations, as you can see in this picture. If we look at the stomach more grossly, it has these folds and it is very thick and it has an inflammation-like picture. The mucosa may also show a granular green-black exudate, and these edematous mucosa may exhibit polymorphonuclear infiltrate and gram-positive and gram-negative organisms. They may also induce vascular thrombosis and, other than that, areas of necrosis within the stomach. As you can see, these are the folds within the stomach, and it is the reddish part expresses that it's a little more inflamed and edematous. The mortality rate of phlegmonous gastritis is 70% because this is usually misdiagnosed and the treatment is usually initiated very late. So that's why the rate of this type of gastritis is usually very high. The treatment option regarding acute gastritis is the resection or the drainage of the stomach with broad spectrum antibiotics. Broad spectrum antibiotics against E. coli and gram negative bacteria and Staph aureus. It is usually associated with granulocytic leukemia and neutropenia. So in this picture, this is a picture of the resection of the stomach, also known as the gastrectomy. This shaded part is the part of the stomach that is going to be resected, and that consists of the acute gastritis. So in the gastrectomy and the resection, what we do is that we completely take the part of this involved in this abnormal mucosal surface of the stomach, and we directly connect it to the small intestine or the large intestine. So acute erosive gastritis, also known as reactive gastritis, it is the gastritis within the epithelial cells of the mucosa of the gastritis of the gastric epithelium, and it consists of different mechanisms that does not involve inflammatory cells to develop. It usually induces injury to the gastric epithelium, and then which completely leads to epithelial restitution, and then finally cell regeneration and hyperplasia. So this sort of gastritis does not involve any edema or inflammation and the colonization of different epithelial cells and the inflammatory cells. So this is more of a reaction as compared to the inflammatory gastritis. This sort of gastritis usually increases with age, and if you see more grossly, it has well-defined hemorrhagic lesions, which is around 1 to 2 millimeter. If you see endoscopically, we can see as this picture, the mucosa consists of red streaks and subepithelial hemorrhages that are very visible through the endoscope. The superficial lamina propria necrosis also occurs in a more late stage or more advanced stage. And there is also a foveolar hyperplasia, which is a hyperplasia consisting of epithelial cells. So if we talk about acute erosive gastritis, what are the main causes regarding this gastritis? It consists of medication and toxins ingestion. And then the reflex of bile. Bile reflex is from the duodenum into the gastrum. And then the taking of cocaine and the use of drugs. Stress-related gastritis, radiations, ischemia, and finally prolapse. These are all the different causative agents and causative factors regarding reactive gastropathy or acute erosive gastritis. So if we firstly talk about medications and toxins, the different types of medications, including aspirin and NSAIDs, they are the causative factor regarding acute erosive gastritis without the inflammation. Iron supplements, fluorides, bisphosphonates, cancer chemotherapy drugs, sodium phosphate, and bromazepam are the medications that when a patient ingests, the patient might develop acute erosive gastritis. Other than that, there are different types of harmful toxins that if a patient ingests, they could react and cause reactive gastropathy, such as heavy metals, selenium, caustic or corrosive agents ingestion, ethyl alcohol, and inhaled ketamine. So if we talk about ethyl alcohol more precisely, the ingestion of alcohol or ethanol causes the reactive gastropathy to occur, and it can also cause different type of hemorrhages and ulcers within the stomach. And the combined effect of alcohol and NSAIDs has a more drastic effect on the epithelium of the mucosa of the stomach as compared to one of these agents used alone. So if we talk about bile reflex regarding acute erosive gastritis, this sort of bile reflex gastritis usually occurs after operations for peptic ulcer or gastric cancers. Operations such as cholecystectomy and biliary sphincterotomy, which are procedures which causes more exposure of the bile to the stomach. For example, bile occurring from the gallbladder have a reflex and they go back into the stomach and causes gastritis. It is usually in adults with dyspeptic symptoms, and the final stage, in the advanced stage, the complication, it might result in intestinal metaplasia. So if we see histologically, the presence of intestinal metaplasia and tissue edema, and this sort of gastritis is usually absent with Helicobacter pylori infection and chronic inflammation. And if we see more endoscopically, there might be swelling, redness, erosion, and stains of bile around the mucosa. This is a picture of an gastric epithelium more endoscopically, and you can see that there's slight swelling, and there is redness and bile staining regarding reflux. And if you take a biopsy picture of the acute erosive gastritis, you can see foveolar hyperplasia, dilated cystic glands, and atypical glands. The atypical glands can also be misdiagnosed as dysplasia or cancer. And finally, the treatment regarding acute erosive gastritis with bile reflux is cholecystectomy with the addition of giving patients proton pump inhibitors and antacids. And finally, Rui NX NY diversion sort of a procedure can also be taken place prior to patients with Billroth 2 procedures. So this sort of surgery is when a small portion of the stomach is directly connected to the small intestine and bypassing a large part of the stomach and the duodenum. So this is a surgery that is very up to date these days. So if we talk about other causating factors regarding acute erosive gastritis, it could be cocaine, which causes hemorrhage, gastric ulceration, and pyloric perforation. So individuals who misuse cocaine can also cause acute erosive gastritis. Other than that, there are stress-related gastritis such as physical or thermal trauma, shock, sepsis, or head injury can also cause this reactive gastropathy. Other than that, there are different types of radiation, such as ionizing radiations. There is an acute and a chronic radiation. Acute radiation is when the radiation occurs for less than 6 months, and the chronic radiation is that if a patient has these radiations for over a year. The gross picture of these type of gastritis regarding radiations is that the ulcers might be solitary and around 0.5 to 2 centimeters and usually located more in the antral region of the stomach. The end of the stomach is called as the antral region. Ischemia, it is usually secondary to chronic mesenteric insufficiency with erythematous embolization. So this sort of ischemic gastritis is occurring in patients who are athletes and who have long distance running in their history. Other than that, finally, prolapse regarding acute erosive gastritis. The prolapse of the cardia part of the stomach into the esophagus, it can cause harmful effects and it can cause injury to the gastric cardia. So this is the gastric cardia, this is the part of the stomach, and it usually prolapses into the esophagus and causes injury. So this prolapsed gastric mucosa usually shows erosions and ulcers and superficial ulcers. So now if we talk about chronic gastritis, this is more common as compared to acute gastritis, as acute gastritis is more rare. It is usually occurring due to risk factors for peptic ulcer disease, gastric hyperplastic polyps, and the third is the benign malignant gastric neoplasms or cancers. So these are the risk factors for chronic gastritis. This chronic gastritis is usually divided into three types. The first one is the diffuse antral gastritis. That the antral part of the stomach is usually involved in a more diffuse manner. The second type is the environmental metaplastic atrophic gastritis, and the third is the autoimmune metaplastic atrophic gastritis, which we'd be studying in more detail. So chronic gastritis is usually due to Helicobacter pylori infection. This is usually the most common cause of chronic gastritis. It is characterized by mucosal infiltration by plasma cells that contain a very specific sort of cells called as the Russell bodies. A form of chronic gastritis is called as the nodular gastritis, which is usually seen in Crohn's disease, syphilitic gastritis, amyloidosis, and different types of gastritis, such as the collagenous gastritis and the lymphatous gastritis. So in this picture, you can see that H. pylori infection, how does it cause an ulcer within the epithelium and the mucosal surface of the stomach, causes inflammation and ulcer. So chronic atrophic gastritis has two folds. The first being the loss of specialized cells within the gastric glands, for example, such as the parietal cells, and then which leads to reduction or absence of the secreted products. Secreted products such as HCl, hydrochloric acid, is being produced within the mucosa, within the stomach, and such as intrinsic factor, which is a very important factor for digestion within the stomach. And it would lead into adverse consequences such as vitamin B12 absorption and some of the elements deficiency and enteric infections. And secondly, the second fold regarding chronic atrophic gastritis is that these patients with chronic atrophic gastritis, they have an increased intestinal metaplasia, which is at risk, and they are completely at risk of developing gastric dysplasia and cancer. So if we talk about chronic gastritis classification, it is divided into two types of gastritis. First being the environmental metaplastic atrophic gastritis, which is also called as mucosal atrophic gastritis. And the second being the autoimmune metaplastic atrophic gastritis, which is also called as diffuse confocal gastritis. Now, if we talk about autoimmune atrophic gastritis and the environmental atrophic gastritis in more details, the pathogenesis regarding autoimmune atrophic gastritis is the antibodies to the intrinsic factor and parietal cells. So this sort of gastritis is usually more of an autoimmune type, and it causes intrinsic factor and parietal cell antibodies to react against the epithelial surface of the stomach. So, and other than that, the environmental acute atrophic gastritis has more of a pathogenesis that is related to Helicobacter pylori infection. Whether the infection is active and current or whether the infection was in the past. Other than that, the autoimmune atrophic gastritis is more of an autoimmune type and thus it is more associated with other type of autoimmune diseases such as diabetes mellitus and thyroid disorders such as Hashimoto's and Graves' disease. Other than that, as the environmental atrophic gastritis, it is more related to Helicobacter pylori infection. So the eradication of this infection and the complete treatment of this infection can cause a reversal of this type of gastritis. So if we talk about the location within the stomach, the autoimmune sort of gastritis is more often antral sparing gastritis. It does not involve the lower end of the stomach, whereas the environmental atrophic gastritis has more of an antral involvement. It is usually occurring within the gastrointestinal tract, but is more common within the stomach, being the antral part of the stomach. So the autoimmune atrophic gastritis has a very low serum pepsinogen 1 factor, and the ratio of this pepsinogen 1 and 2 ratio is very low, whereas there is a complete opposite with environmental atrophic gastritis. The serum pepsinogen levels are very, very high. Other than that, there is an increase in hypergastrinemia, which is the gastrin which is produced within the stomach. So in autoimmune atrophic gastritis, there's an increase in the factor gastrin, whereas there's a normal or slight increase in serum gastrin in the environmental atrophic gastritis. Other than that, lastly, autoimmune atrophic gastritis is more prone to proceed to a more complicated type of gastric carcinoid tumors, whereas environmental atrophic gastritis does not have any association with neoplasm or cancers. That's all from this section regarding gastritis, acute and chronic gastritis. Keep watching the different types of gastritis in the next section regarding this lecture. Thank you for watching sqadia.com.